Hi, Dr. Eric Lund here, your local Roseville and St. Paul chiropractor, specializing in short-term care for your neck pain, back pain, and headaches. And the topic in this video is related to whiplash. And so I wanted to go over what are a couple factors that can make whiplash injuries more severe. So commonly, whiplash, the most common way you get it would be being involved in a motor vehicle accident. Some of the common symptoms are going to be neck pain, back pain, headaches. And so a couple of the factors that will make it worse. So number one is looking at the damage of the car. Some people think like, oh, if there's no damage, there isn't going to be as bad an injury. And that's actually not the case, because when a car is damaged or deforms, it reduces the forces that are transmitted to you as the occupant. So oftentimes if there's less damage to your car, that means that more force was generated to you, which can, in many cases, actually make the injuries to your neck and back more severe. The second factor that you want to look at is when you were hit, where you turned. So sometimes you may be looking in a mirror or talking to someone, but if your head or neck or body is turned in any fashion, that can also increase the severity of injury. So most commonly, let's say if you were driving and you were turned slightly to the right, a lot of times that's going to make the injury to the right side of your neck worse compared to if you were facing forward. And just a couple other things with this is what we know with whiplash is that it's very important that when you have this injury and you have these symptoms, that you seek proper treatment very early on in the onset of the symptoms. And manual therapy continues to be shown to be the most effective treatment for whiplash injury. So that's things like spinal manipulation, which is what the type of treatment that a chiropractor would provide. So again, very important information is the earlier you can start to receive the proper treatment after whiplash, the better. And we know that one of the worst things you can do is the wait and see approach. So you get this type of injury and you say, oh, I'm going to give it a week or two to see if it feels better, or maybe you go to your doctor and they shoot an x-ray and they say, you know, we don't see a fracture, just give it a few weeks and check back if you're still not feeling well. So we know that the wait and see approach, that's not what we want to do. What we want to do is right away start to begin to receive the proper treatment, which is manual therapy for these injuries. And the sooner patients come in from whiplash, the much faster that they feel better. So if I start working with a patient that had a whiplash injury and they're in 1 to 5 days after it happened, the turnaround time and the improvement in which we can get their symptoms is so much faster than if someone waits a month or two and they're still having symptoms. So again, that's a very key point with whiplash, is start receiving proper treatment as fast as you can. Thanks for watching, and we'll see you next time.